My name's Peggy Dominguez. I am an English 1 and English 2 teacher at Timber Creek High School in Orange County. Let me explain who my students are first before I talk to you about the rest of it. 76% of my students in a general education English class are identified as ESE. They have IEPs, whether it's for a disability, whether it's a learning disability, or they have another medical diagnosis. The remainder 24% of my students are considered low learners. They cannot read nor write at grade level. The reason that I am here is because my students come to me with a reading lexile level of 3rd grade to 5th grade. That is the average. I have to provide accommodations daily to them according to their IEPs. I also differentiate my lessons for them. They have many different learning styles. There are different issues with my hearing disabled. I have to provide other accommodations as far as providing visual effects, making sure that I'm speaking directly to them face to face. All of that is incorporated every day that I interact with my students, all of the time and planning that goes into it. The reason that I'm explaining these accommodations and differentiations to you is because this is not used during state testing. When I administer and I proctor the FSA, I am not allowed to give those accommodations and differentiate the tests to those same students. If you want the FSA to accurately test and measure these students according to what they can academically gain and the learning goals and the gains that they make throughout the standards that we give to them and we teach to them during the year, then you need to allow for accommodations and differentiation among these tests. It is not an authentic assessment of what my students can do. During this last year in preparation for the FSA, we lost 37 school days of instructional time in ELA to prepping them for the FSA. And I am not talking about teaching to the standards, and I am not talking about just walking them through how to take the test. I am talking about trying to walk them through the instructions to show them what the testing platform looks like, which is what we were told that we had to do, between laptops failing, between the server not being able to handle every classroom doing this. 37 instruction days are gone. That is over 7 weeks of instructional time. That is close to 1 quarter, and it's gone. I can't get that back from my students. This translates into high anxiety for my students. I also have to deal with questions from parents. What do I do if my student doesn't pass? The FSAs are intended to show a student's learning gains. They are also to show academic growth with the ELA standards. However, excessively stringent and applied tests along with their data groupings do not truly inform you of the gains that my students make. I'm not talking about every general education student. It's not a true assessment. It's not what Senator Mumford called a common sense accountability system. It also impacts my VAM scores. At the beginning of my teaching career, all the way up through last year, I was ranked as a 3.85 highly effective teacher. I want to teach low learners. I want to teach students that have at-risk behavior. I want my students. Last year, due to the FSA scores of my students, I was given a 1.2. I filed the appeal. It was denied. However, my evaluation score from my administration was a 3.6. The people closest to the students should make the decisions about what makes sense to help a teacher improve their performance, not some stranger adding up numbers in a New York City office. My principals, multiple principals, who came in over 9 times over the entire year, the district came in and evaluated. I had weeks where I had people in my classroom 5 and 6 times a week, told me that I was highly effective. But the state feels that I'm ineffective as a teacher. I have to pull my students from a 3rd grade reading level up to an on-level reading level at a 9th or 10th grade proficiency. and it's impossible to do in that time period of 1 year. With all of these restrictions and evaluation methods that you have placed on students and teachers, I ask you, why would anyone continue to choose to teach students who are labeled low-level or below-grade level learners, disabled, ESE, 504, or even behaviorally challenged?
Peggy, are you pretty close to the end? We only
I
got
am.
3 minutes, and we got 2 more people.
Where will you find the trained professionals who are willing and desire to work with these students if you continue to make VAM scores the way they are and the testing the way it is?